My name is Bertrand Babinet. I am an acupuncturist. I have 20 years of experience in the field of acupuncture. And I have a PhD in human development. And I usually work my clients in a body-mind approach. And I'm a co-inventor of the machine with David Thomas. And I'm here to basically demonstrate an aspect of the machine which has been very helpful in my practice in working with my clients. Okay, so I'm working with Denise here, and what I want to show you first is my method of muscle testing. It's very simple and is designed to minimize the level of mistakes in working with clients. So we have a strong, and we have a weak, and we have a no, and we have a yes. Now what we have found is that in using the frequency of the machine, what we do is that we use the yes to tell us when we obtain the right frequencies. And I'll go over that later when I actually do it. So the first thing is to identify whether there is a pattern of imbalance that we can correct at this time. And we can do that in many different ways. We can do that, for example, by contacting different point in the body. So here we have the point for the spleen, so it tells us that there is an imbalance in the spleen. Okay, we could test the point for the lung, which are pretty good. We could test the point for the heart. We could test the point, for the stomach. So there are many different ways of testing. Most people wouldn't agree on those points, but as long as it's congruent with your approach, it's going to work. Now another way of doing that is just asking. So we could ask heart, small intestine, stomach, spleen, large intestine, lung, kidney, bladder, gallbladder, liver. And so we know that we have a spleen-liver imbalance, okay? We could have done it through contact, again, spleen and liver, okay? So there are many different ways. We could also focus and we obtain the same thing. What I'm going to show you, so we know what our pattern of imbalance is. Now what we're going to do is identify what are the frequencies that would be more effective in correcting that imbalance in spleen and liver. Okay? So I'm going to bring the machine a little closer to myself so that I can do it while I muscle test. I may change the machine for the treatment itself. And I'm going to bring the machine to 0. Just a second. And what I'm going to do is select first which knob to start with. And again, the weak point is going to tell me which one to start with. And I'm going to turn it progressively, waiting for the response in Denise's arms. Okay? Then I'm going to select again which next one. So this time I just did the blue, this time I'm doing the green. And again, I get the second frequency. Then I'm going to go see whether there is anything in the first knob, and the treatment doesn't require a third knob. It just wants to treat with blue and green. So it's basically a combination. Now we can ask whether it would be easier to have this closer to her, a little bit more away from her. So would that be okay to put it on the shelf here? It's like, yes, it would be just fine. So I'm just going to leave the room for a couple of minutes and give a chance for the treatment to work, and then I will come back for the second phase of the treatment. So we're going to re-establish what we were doing before: heart, small intestine, stomach, spleen, large intestine, lung, kidney, bladder, gallbladder, liver. So we find that it's been very effective. We can go back to those contact points that we used before, and we see that the machine has effectively treated that level of imbalance. Now what we found is sometimes helpful is to ask whether there is another layer at which it would be valuable to treat, because sometimes imbalances in the body are not just one layer, but there may be many layers. Okay? There might be a physical layer, there could be an emotional layer, there could be a mental layer, there could be an organ layer, there could be a neurological layer, there could be another green layer. So we basically test again, is there another layer to that disturbance? And it says yes. So we basically are doing the new level of depth, and red doesn't have anything, green doesn't have anything at this time, blue has something. So again, we look at the green, we look at the red, so you see that it's a totally different frequency. Okay. And then green, and at this time we also want a green frequency in the mix. Okay, and then again, you relax and you breathe, and I leave the room. So we check again. We ask whether there is any other level of depth. So basically, we completed our treatment. We established that there were two level of depth to the system, to the treatment, and basically we did our second level of depth. One thing that I want to go over now is, because it's very important for me, and I think for the environment in which I work, is that I use the machine clearing mode every time I treat a client, and I use the machine clearing mode for at least 4 or 5 minutes between clients to give a chance for the energy which has been released in the room to be dispersed before I bring another person in the room who otherwise might catch some of the energy which has been released, and then I would not know exactly what I'm testing. Okay. So there is a machine clearing mode. Yes. So the machine clearing mode goes through all the colors, and it's just in that process of going through all the colors, what it does is that it kind of disperses everything which has been released and allows the environment to come back into a place of balance before you bring the next client. So that's the completion of my treatment. The only thing I might want now is to ask Denise how she feels.
I'm feeling well.
You feel well, we can see that the spleen and the liver are much more balanced, and we can check the physical, creative, visual, emotional, mental, unconscious, and spiritual, and we see that in fact she has been treated not only at the physical level, but all the levels simultaneously which have caused the level of imbalance inside of the body. Thank you very much, Denise.